Sorry, everyone, I am not able to open my camera right now. Welcome back again. Hope you really had fruitful sessions so far, and I enjoyed your breakout rooms very much. Thanks again for being part of this discussion processes by joining our sessions and sharing your valuable inputs with us. And in this part of the plenary, one of our moderators from each plenary, each breakout rooms will share the summary of the discussion that is happening in the respective breakout sessions. Ömer and I will be facilitating this part of the session. To start by introducing myself briefly, my name is Ervam. I am from Turkey and I volunteers with the UN Major Group for Children and Youth as global focal point for humanitarian affairs constituency. Ömer, would you like to introduce yourself?
Yes, thank you, Erva. Welcome back, everyone. I hope you had fruitful discussions in the breakout groups, and I can't wait to hear your reports and your summaries. My name is Ömer Faruk Sönmez. I'm from Turkey. I'm a youth health advocate holding executive officer role at European Dental Students Association. And I'm a youth health working group member for Civil Life Association, which is a youth-led NGO with a consultancy to the United Nations. Thank you, Aurora.
Thank you. Now, quickly to start listening to these summaries from each group, I would like to start with Soba. She's from Uganda. She works with the Reach a Hand. Soba will be sharing the summary with us from the breakout group, including Nepal, Bhutan, Sri Lanka, China. And I guess I missed some of the country names, but maybe Soba can remind us if I missed any. Soba, would you like to go on?
Thank you very much. So, in our we discussed some of the submissions for chapter 3 were the one for participation, meaningful participation. One of the questions was how agencies will involve adolescents in more decision making. Then one of the submissions was to have more dialogues with the young people or adolescents, and then that the tool would also help organizations to understand more about youth participation and understand that tokenism is not really participation. Then we had chapter 7, which is data for action. One of the submission was on the question of how can your agency help with providing more evidence for what works and what does not work for adolescents' sexual reproductive health in emergencies. Was they should carry out direct surveys to inquire from the adolescents on what really works for them and what really doesn't work for them, to carry out regular meetings, then how the tool would be useful and helpful. It would be helpful in creating or making advocacy papers, and also to use the data in designing projects. Thank you. That is a summary of what we discussed. Of course, we had a lot of submissions, as you will see from the recordings. Thank you.
Thank you, Soba. Thank you so much, Soba, for this summary and for this amazing time management. Now I would like to invite Bhumika for the other group discussion for the same countries. Bhumika is from India, and Bhumika works with the Policy Working Group STEPS and the Youth Parliament Foundation. Please go ahead, Bhumika. Bhumika, can you hear me?
We have Maldives, Mongolia, Sri Lanka. Yeah, am I audible?
Yes. Please go
Am
ahead.
I audible, Hilva? Okay, thank you. So the first question that was asked to the audience was, what do you think are the problems adolescents have been facing with regards to SRH in pre-COVID and then during the pandemic? So the main themes that came out were assessed to SRH services, forced marriages, unintended pregnancies, intimate partner violence, early union, and gender-based violence. Then the second question that was asked regarding chapter 3 was that how do you think you or your organization can engage adolescents who live in hard to reach areas and engage them beyond tokenistic participation? So the main submissions that came in were that we can make them work in community development and see the changes. During the COVID, online awareness sessions could be taken out through peer educators. Adolescents could also be engaged who are already leaders in the community, and online engagement through various sessions, webinars, and all are also important. There's also asked that equal representation in committees would also help. Then there were the several themes that came out were risk of early marriage, domestic violence, access to SRH services, data collection, HS settings, and separate facilities during COVID. Thank you. Thank you, everyone. It was a wonderful audience.
Thanks so much, Bhumika, for the great points you raised. Now we will listen to Oko on behalf of the Pacific Group. Oko is from Ghana, and Oko works with the African Youth and Adolescents Network on Population and Development and Family Planning 2020 Youth. And Oko is Family Planning to 2020 Youth Focal Point. Over to you, Oko.
So one of the questions thrown to participants and the response, one of the questions was the issues adolescents face in humanitarian settings regarding their sexual and reproductive health. And our participants shared a few thoughts. So the feedback was that adolescents in humanitarian settings, especially on their sexual and reproductive health and rights, their voices are unheard, and their participations in decision making is also limited due to the loss of communication channels. And adolescents are also at risk of abuse and violence. In humanitarian settings, we also learned that they are invisible as a group, as often they are referred to within other groups, but not specifically addressed as adolescents. Therefore, you realize that specific programs and interventions that should meet the needs of adolescents may not be met entirely because they are usually integrated within other groups. Now, we also asked how the toolkit would help our participants in their organizations and communities in terms of designing programs to overcome the challenges that they face. And one of our participants shared that the toolkit will be an excellent resource to help with advocacy, integration of adolescent SRHR in preparedness activities, and also to highlight the importance of meaningful participation to donors so that there may be more funding and support to implement programs for adolescent sexual reproductive health in humanitarian settings. Thank you very much.
Thank you. Great time management again. Thank you so much for this very valuable point, Oko. Now I would like to invite Anita for the other Pacific Group discussion. Anita is from Nigeria. Anita works with Brave Heart Initiative for Youth and Women. Please go ahead, Anita.
Hello, guys. I'll have to sit in for Anita. She didn't show up. So I'm Che for the Southeast Asia group. So just a brief summary, we had a very interactive session, and a lot of participants had to contribute their ideas on the issues faced by adolescents. Some talk about sexual violence in their areas and what they face in the field, neglect, separation from parents, and loss of parents, as well as lack of youth-friendly health services, mentioning the fact that most health services are focused more on children and pregnant women during humanitarian crises rather than also adolescents and youths, and also the lack of menstrual hygiene and products as well. And also we had a lady from Thailand who recounts how they've been able to, who works with AZPC, how they've been able to do a lot of capacity development programs, and how they can be able to use the toolkit as a reference to teach in institutions, as well as use it as a reference to teach others and as well as their other staffs. And also there was a great contribution of how important holistic programming is and the integration of this holistic program, considering the fact that working in collaboration with each other helps to duplicate initiatives as well as maximize resources if we work in coordination. So there was this great contribution of how important rendering holistic services to adolescents in humanitarian crisis areas is important. And finally, there was also a great contribution on how the toolkit will be used to train staff and volunteers in order to improve on capacity building of youths in different community areas. Thank you.
Thank you so much all for these great, amazing inputs and summaries so far. Ömer, would you like to go ahead for the rest of the team?
Yeah, thank you. Thank you, Arba, and thank you, Che, for your report. Now it's time for the fifth breakout group, which is Iran, Pakistan, India, Bangladesh, and Afghanistan, to share what they've discussed. Youth moderator Anas from YPeer International Network from Pakistan will deliver this summary. Over to you, Anas.
Thank you, Ahmad. So in our group, in our breakout room, we discussed chapter 4, which is priority ASRH in emergency activities and going beyond health services. We addressed some of the challenges that face ASRH in Pakistan. In particular, we had so many participants from Pakistan who shared their experiences in their country, highlighting the issue of early marriage, early pregnancy, which leads in many cases to onset abortion, maternal death, and other unintentional consequences like child labor and other issues. There are also a lack of hygiene, lack of awareness, GBV, and other critical issues that occur in humanitarian settings. And we also discussed the lack of services versus the lack of access to these services in these humanitarian settings. The participants also shared their experience using the MISP, which is the minimum initial service package for reproductive health in crisis situations, and the challenges they faced in implementing it, especially with adolescents, reaching them out and engaging them as well. So since participants did not yet go through the designated chapters of the toolkit, they expressed their expectations to have more communication methods explained in the toolkit on how to approach adolescents, especially young girls. For many societal norms and cultural restrictions in these countries, it is sometimes very hard to reach out to them and to discuss with them sexual health and hygiene related topics, which is included in chapter 4 and 5 as well. So they are expecting to have these information delivered. The toolkit will also help to actively integrate and work collaboratively with other sectors and identify what are the best suitable entry point to approach adolescents in their countries. Other ideas we discussed is to include young people in meetings and coordination work of ASRH, which showed that it was a way to voice the concerns of young people and give more role for school health programs and robust coordination with education sector. Thank you, Ahmad.
Thank you, Anas. It seems like you've had an interesting discussion. Thank you. So the second group, the breakout group of Iran, Pakistan, India, Bangladesh, and Afghanistan is now going to share the summary with you. Amit from Youth Coalition for Sexual and Reproductive Rights from Nepal. Floor is yours, Amit.
Thank you so much, Omar. We started our conversation with various sexual and reproductive health issues that adolescents face, ranging from the safety of adolescent, family planning, menstrual hygiene management, and also like availability of services, and also the awareness of healthcare provider and other managers on importance of sexual and reproductive health among adolescents. And we also discussed in the chapter 4, like it was about priority ASRH activities in the emergency setting. And the participant discussed about the minimum initial service package for adolescent. And also we discussed how various clusters can come together to deliver full package targeting adolescent and young people, especially in crisis situation. And the chapter 5 was about moving beyond, going beyond health services. And then at that chapter, we discussed how and why it is important to move beyond health services. And we focused on holistic lens to see a clear and bigger picture to address the need of adolescent, and also the socio-ecological model that the chapter offers on how the healthcare provider or like the manager can work in their own field or work in the area addressing the SRH need of adolescent. And the participant also discussed like how the toolkit can be very helpful to design projects to work for adolescent and youth, and how we can view it through holistic lens. Thank you.
Thank you, Amit, for your report. And now we go to Audrey from Youth Exchange Zimbabwe to summarize the inputs throughout the discussion for us for the first breakout group of Southeast Asian countries. Over to you, Audrey.
Thank you so much, Amash. For our group, we're focusing on chapter 1 and chapter 6, and they say that they'll be able to utilize the toolkit because it's got a good background information for advocacy and capacity building. It also informs programming utilizing the socioeconomic model, and it can also adapt the programming in the sense that it identifies young people in their diversity. It further breaks them down into their vulnerable subgroups. And focusing on chapter 6, Chapter 6 has got adolescent sexual reproductive health services, adolescent-friendly services, training and capacity building of staff, facility-based services, as well as the principles of adolescent-friendly services, which are acceptable, appropriate, effective, and equitable. The challenges that are faced by most adolescents in accessing sexual and reproductive health is that there are long distances to health facilities, movement restrictions, stigma and discrimination. Health system is overloaded with COVID-19, which means that the response is poor and prioritization on sexual and reproductive health services is very weak. And it's difficult to access remote services due to small housing in post-crisis IDP camps, and also to access mobile outreach programs within the camp due to fear of letting the other camp residents know. I can go on and on and on, but for now, I think I'll end here. Thank you, Amash.
Thank you for your time management, Audrey. It seems like you had a fruitful discussion. And now our last breakout group will give us the report. But before, I would like to remind that all the recordings will be made available on YouTube, including breakout sessions after the launch. So you don't worry if you have to leave the meeting now. You will have chance to watch them later on. And now Pauline from Organization of Africa Youth from Kenya will deliver the summary for us for her breakout group. Now over to you, Pauline.
Thank you so much, Omar. I beg not to have my camera on because of connectivity issues. So we also discussed chapter 1 and chapter 6. So participants in our group said that they used the information from chapter 1, which is the introduction to the toolkit, mainly for advocacy purposes, generation of data, and to reach the targeted populations. And they'd also use it in developing and designing the context and population tailored programs. They also reported that they'd use it in implementing the right interventions for their adolescents and youth, being that there's defined the well definition of the different subgroups amongst adolescents. They also said that use it in tailoring program implementation using the toolkit, and also for meaningful involvement of the target groups with peer-to-peer networking. And it also gave them a sense of awakening. They noted that they need to prioritize SRHR needs, especially in times of emergencies, especially for the most vulnerable groups amongst adolescents within their context. And the global launch made it possible, they said makes it possible for policymakers to increase their awareness and also to revamp their advocacy strategies for the SRHR. And this will be considered important, especially in conflict areas. So for chapter 6, that mainly explores the access to services and interventions. They said it was important, the information was important in revamping both the supply side and the demand side of things. The supply side mainly for healthcare providers, and also the demand side for the receivers, so the recipients of the services. So they say that they'd use it in capacity building and training the staff and also members of within the organizations, and mainly the staff that are also providing these services at their centers. And the information would also guide their discussion and advocacy efforts with relevant stakeholders, and in using effective approaches for service delivery in ASRH, adolescent sexual and reproductive health and services. So it would also help in boosting access to the guidelines and toolkits, especially for organizations that are from remote areas that lack access to this. And this would help the local agencies and stakeholders to be able to act on the basic needs of the young people within their context. Thank you so much, and that was our discussion.
Thank you, Pauline, for your report, and thank you all for your amazing efforts and your important inputs during the breakout groups. We'll have a chance to watch them once the recordings of all groups will be made available after the launch of on YouTube. So now we will move over to Anas and Katie to take us away to close out our lunch. Floor is yours.
Thank you, Amin. So here we are getting out to the end of this wonderful and energetic launch event of the ASRH Toolkit 2020. It was really very useful, fruitful, and helpful to all of us to hear these diverse insights and experiences shared during the discussions in all the rooms and in the plenary as well. At this point, I would like to thank everyone for joining the launch and actively participating in the discussions. I would like also to thank the amazing 18 youth moderators and 9 co-facilitators who led us through this launch. I would like also to thank the Dutch Ministry of Foreign Affairs for providing the funds to make the revision of the toolkit possible. And of course, I would like to thank the IAWAG's ASRH sub-working group members for leading the revision process and all those who provided input to revision. And in these final seconds, I would like to address Katie. Katie is the star of this launch event for the tremendous and the outstanding efforts that she put to make this event a success. So thank you, Katie, to connect all youth moderators and to connect everyone together to have this amazing launch. So thank you, and over to you now.
Thank you so much, Anas, and thank you so much to all of our moderators. You all are so inspiring, and this has been such an energetic event. I think this is the most energized I've ever been at 1 in the morning. So thank you so much, everybody, for participating. Thank you to all of our facilitators, and thank you for all of the people behind the scenes who made the logistics of this launch a success. We hope that you will stay engaged in the toolkit discussions and conversation, as well as rolling out the toolkit. If you want to stay involved in this, please email me. It's at kmeyer@savechildren.org on the slide. As well, if you have any feedback for how the launches went, please send that to us as well, and we'll be sharing all of the recordings as well as the announcements on the Arabic, French, and Spanish versions of the toolkit as well. Thank you all. Have a great night, morning, afternoon, and enjoy the rest of your week. Thank you so much.